Okay? All right. Now, it is my pleasure indeed to introduce Mike Szukala, MBA, CIA, is Erie County's Medicaid Inspector General. He is responsible for leading a team of 2 in their reviews of Medicaid expenditures in Erie County. In 2014, over 258,000 Erie County residents received some form of Medicaid benefit, this being roughly 25% of the county's population. Medicaid costs for 2014 in Erie County were over $1.6 billion, although Erie County's share of those costs is capped at about $211 million. Mike was appointed to the position in September of 2012. Erie County's Medicaid Inspector General team, the MIG team, operates in conjunction with the New York State Office of the Medicaid Inspector General. OMIG provides legal authority, training, and technical assistance while the MIG team performs the actual audits. The types of audits performed include transportation providers, pharmacies, providers of durable medical equipment, such as wheelchairs, and audits of assisted living programs. Operating under agreements with OMIG, the MIG team has completed or is in the process of completing 23 audits. This audit covers more than $80 million in Medicaid expenses. Prior to his current position, Mike was appointed in 2006 by the then Comptroller Mark Poloncarz to be Erie County's Chief Audit Executive County Auditor. In that role, Mike oversaw the release of over 60 audits, reviews, and reports covering 260 recommendations and identified more than $29 million in savings to the people of Erie County. Mike served in the role of CAE for almost 7 years, the longest-serving county auditor in Erie County history, and the only county auditor to serve under 3 comptrollers. Believe me, that is quite a feat. I can attest to that. In 2007, the Association of Local County Government Auditors awarded the Erie County Audit Division with the Knighton Award. The Knighton Award is for excellence within the government audit profession. Erie County was the first New York municipality to ever win a Knighton Award. I talked with Mike before this and gave him an opportunity. I said, listen, these are new students. Some know a little bit about it, Medicaid. Others barely know what it's about, so kind of focus on that. And it's up to him. He may want to take questions during the course of this, or we can wait, as we often do, to the end. So I'm really pleased to have Mike here, and now there you go, Mike, take it away.
Thank you, Professor. I hope everybody can hear me now. As I was so generously introduced, my name is Mike Szukala, and I am the Medicaid Inspector General. Now, before we go any farther than that, isn't that a great title? That is a great title. It is a great title. It is a lot of fun to be able to say, I'm the Medicaid Inspector General. What I want to do before I get into this, though, is just 1 minute. I want to talk about how I ended up with a great title, because there's a story there in and of itself. And the other side of it is, I believe that all of you at one point or another will be either working with government, either at a not-for-profit or a private agency, or some of you may have the good fortune to see me or one of my professional colleagues in our professional capacity. You'll have a chance to be audited by the MIG office or my counterparts at New York State, the Office of the Medicaid Inspector General. So I want to set the stage so you have a little bit of a better idea of who I am and who we are. New York State, as was said, has an Office of the Medicaid Inspector General. It is a statewide office that was originally set up to root out waste, fraud, abuse, and mismanagement for the Medicaid program, and it's been in existence since about Medicaid started. That's the good part. The bad part is Medicaid as it exists, OMIG as it exists now has only been that way since 2006. And the reason is, well, welcome to politics and welcome to government. Well, for most of OMIG's existence, it has labored under 3 accusations. It is composed of cronyism, nepotism, and incompetence. And that's part of the reason I stand here today. I've worked with folks at OMIG since September of 2012, and I can tell you, I think they're all very competent public servants who do their jobs very well. Unfortunately, and this is government, what I think doesn't matter. And some of the legislators in Albany, some for political reasons and some because they genuinely believe these accusations, have tried time and time again to reform New York State OMEG, or if not that, in some cases to actually eliminate it completely. What happened was in really about 2011, the current governor decided that he would establish something different. Convinced that there was, well, and once again it's his opinion, convinced that there is waste and mismanagement within the office of the New York State Medicaid Inspector General, he created what's known as the County Demonstration Program, otherwise known as the County Pilot Program, where instead of New York State doing Medicaid audits, they pushed that authority down to individual counties. They gave each and every county in New York State the opportunity to establish its own Medicaid Inspector General's office. Some counties took advantage of that, and some counties didn't. In Western New York, the counties that took advantage of it are Erie County, which is how I ended up with my job, my counterparts in Szukala County, that's to the south, most of you would know that as Fredonia, area around Fredonia and Jamestown, to the north, Niagara County, and around Rochester, Monroe County. Now there's 8 total counties in the County Pilot Program, so I am not the only person in New York State with the title Medicaid Inspector General. As a matter of fact, there's 9 of us. Takes something of the edge off the title, doesn't it? Oh. Excuse me. Therefore, when I talk today, you'll discover that I talk a lot about Erie County because that's where my authority begins and ends. If I had a map in front of you right now of Erie County, I can tell you from time to time we do audits outside of Erie County, but that's because those individual businesses have a majority of Erie County residents as Medicaid clients. We select audit targets simply based upon the number of Medicaid dollars they take in. That decides whether or not I have the authority to audit them, or, for example, my counterparts in Niagara County, his name is Leo, whether Leo has the opportunity to do that. So there are times when Leo's done audits in Szukala County or Erie County, and I've done audits up north. One of the great things about this is the governor, when he established the County Pilot Program, he just left it up to the counties to establish how it would be done. So when I was offered this position, it was something I was really excited about because it was a completely blank slate. I had the chance to walk into this office and make it what I thought it would be. And the truth is, isn't that a really cool thing? You get to write your own job description and do what you want to do. That's really cool. The bad news is, by the way, if it goes wrong, you're held completely accountable for it. But there it is. And what I wanted this office to be is more than just a group of little accountants sitting at a ledger, scribbling numbers in, and sending memos to people about the fact that you've been overcharged this or you violated that obscure New York State rule. I wanted to do much more than that. And I've always believed this office has the power to do more than that. And I think by the time at the end of this presentation, you'll see I've made some real efforts to do that. There's a ton of data in the New York State Medicaid Data Warehouse, which I'm about to talk to. I recognized that, and I said, nobody's using that for anything other than Medicaid auditing. And what a sad shame that is, because there's tons of information out there. And every year they continue to add new data to it, not just in terms of new clients, but they add different kinds of data that's collected. And I've managed to take that data and I provided it within the limits of HIPAA to other county departments and other entities in order to help them do their jobs better. And as a matter of fact, later you're going to see there are maps here about where Medicaid clients live. Until we put that together in my office, nobody had that. And that Medicaid data was then used to help the NFTA decide where bus routes needed to be and help Erie County where clinics needed to be. Because ideally, you'd put clinics near the population that they serve, right? It's okay, you can nod your head. Yes, that's okay. Yes, that's a good thing. All right, I just want to remind everybody one more moment as I go through the presentation. From time to time, I'm going to have to talk about politics as part of what you see here. I wish politics and public medicine were not connected. I really wish that. Guess what? If you've been paying attention to anything in the news in the past 6 months, you know that's not true. And unfortunately, some of the decisions that you're going to see here, and I'll talk about, some of which are good, some of which are bad, were made by people we all elected. And that's the way it is. And it's something I never forget. I am the Medicaid Inspector General, but I'm also a patronage employee. I hold my job based upon the goodwill of the county executive of every county, and to some extent the governor of the state of New York. If I do something they don't like, they'll let me know. Make no mistake about that. And if I do something they really don't like, I'm unemployed. Let's talk about Medicaid. For those of you that don't know about this, and I realize some of you, by the way, are probably not born in the United States or U.S. citizens. Medicaid is the major public health care program for low-income Americans. A fancy way of saying it's a means-tested program, which in simple English is it's for poor people. It's currently financing health care for over 50 million people. And as your professor said earlier, about 25% of the population here in Erie County gets some form of Medicaid, which tells you about wealth in Erie County. It primarily covers low-income children and parents, the elderly and the disabled, although the elderly is also covered by Medicare. Medicaid is for means-tested people, low income. Medicare is for the elderly. In some cases, you can be covered by both programs. What does that mean? It means you're elderly and poor. What happens then is Medicaid, my folks, pay the premiums for Medicare. Medicaid was authorized by Title 19 of the Social Security Act. It's a federal program, despite the fact that I work for the state. The Affordable Care Act. Beginning in January of 2014, the Affordable Care Act simplified the application for getting Medicaid. That's what they say anyway. The new method uses something called your modified adjusted gross income. I'll bet most of you have filed income taxes before. Actually, everybody raise your hand and just tell me you did anyway. Okay, remember, I'm a government employee. If you're not, that's a bad thing. And it uses something called MAGI or MAGI. MAGI replaces a process that used income deductions that were different in each state and often differed by eligibility group. It was very frustrating to me as the Medicaid Inspector General. We would watch people come in, and people from, for example, and I'll be blunt about this, states that didn't have the same kind of Medicaid program that New York State does. And I'll use an example, Texas, where people would come from Texas and they were told in Texas, you don't qualify for Medicaid. And the problem that you have isn't covered by Medicaid. And they would come here, and the moment they established residency, it was covered. They qualified under Medicaid, and their particular malady was covered. That's one of the problems I have with politics, but I don't get a chance to fix that. The rules can and do differ by state. Now I will ask, does that seem like it makes any sense? If you're sick in one state, you're covered, and you're sick in another state, you're not? Does it make any sense? Anybody? Does that seem fair? Well, you guys are in Masters in Public Health. I hope you'll help me fix that. The new method, they set aside 5% of your income. It's called a disregard. I have actually talked to people who worked on the law, and this was a political deal. It could have just as easily been 7.5% or 2% or whatever. It's just an agreement people came up with amongst themselves, your elected officials. There's really no technical logic behind that, and it drove me crazy. An applicant's adjusted gross income is found on your income tax return. As I said earlier, different states have different eligibility rules. For example, Minnesota uses 200% of poverty level. So if you make poverty level wages, you're comfortably qualified. Texas uses 15% of poverty level. That means if you make about $4,000 a year in Texas, you don't qualify for Medicaid because you're too rich. Everybody okay with that? I'm not okay with that, but I don't get a say in it. It's still an issue. Now, the nice thing about Medicaid is Medicaid does cover some costs retroactively. will go back up to 90 days. So if you come to New York State from another state and you're sick, if you can establish residency in New York State, we'll not only cover your costs going forward, but we'll cover your costs going back. Why? Because you're poor. I happen to like this, but as you can guess, there are some elected officials who think this is wrong. But I happen to think this makes sense. If you're sick and you needed treatment, why shouldn't you go get it? Am I right? Wow. So let's talk about the kinds of income that you have. Let's talk about what it really takes here. Means testing. This is the 2015 Annual Poverty Guidelines. This is what the federal government says the poverty line is for one person. By the way, some of you probably qualify because you don't make any money. That's okay. It's a little over $11,700 a year if you're an individual. If you make less than that, you qualify for Medicaid. Under most circumstances. I always say that because some people will occasionally call my office because they didn't qualify. But there's some sort of a special circumstance. In general, this is a very good guideline. Now, the Affordable Care Act changed it so that it's now 133% of poverty qualifies you for Medicaid. So in New York State, if you're a single person and you're making less than $15,600 a year, you would qualify for Medicaid. Now, as I said, that's a little higher than the poverty line. But remember what your professor said earlier, and something I will remind you of again. About 1 out of every 4 people in Erie County make less than this. Poverty is very real in Erie County. You may not see it, you may not want to hear it, but that doesn't mean it doesn't exist. And some of you, of course, as folks in public policy and masters in public health, you're going to start to encounter this. Now imagine a family of 4, 2 kids, a wife and a husband. If they're both working, they can make up to $32,252 and still qualify. And we still have a lot of people who do that. And you'll see, I'll go through an example right now. Means testing. In New York State, the minimum wage is $8.75. I hope you all knew that. Some of you work. I'm sure everybody's making $8.75. Nobody's getting shortchanged, right? Okay. If you're working 40 hours a week for 50 weeks a year, you're earning a wage of $17,500. If you're a family of 2 with 2 adults, 40 hours per week for 50 weeks at the New York State minimum wage, you'd have an income of $35,000. With no other income or adjustments, your disregard is $1,750. In this case, you would not qualify for Medicaid. You just missed it. However, if someone were to call my office, I would call them and I would say apply anyway, because circumstances may come up during your application that would allow you to qualify. If someone like this, of course, applies and doesn't qualify, they can apply for health care through the Affordable Care Act website that New York State has. They would probably get some assistance from the state or from the federal government making premium payments if they did apply for health care through the Affordable Care Act website that New York State has. But that's how much someone can make and just barely miss it. By the way, these people are probably not living a very glamorous life. There's not a lot of money there. It's going to be tough to make it. They're probably receiving other forms of public assistance, including food stamps and probably help with their utilities. Now, I talked earlier about Medicaid differs between states. It's not just income. It also differs between what kinds of services they cover and what kind of services they don't. New York State covers, I love this, nearly every optional service that Medicaid will pay for. There's actually only one, and I'll tell you about that in a second. Many states don't cover any of the optional items at all. Now, you folks are masters in public health students or people involved in public health. Do you think it's optional that prescription drugs aren't covered? Do you think it's a good idea that eyeglasses aren't covered for people who need them? If you've had your leg amputated, you're going to have to pay for it yourself in some states. And my favorite is to pick on is Texas. These are people who are already poor. This is a means-tested program. And yet they're going to have to go out and buy their own prosthesis. I have a real problem with this. But once again, I don't get a say in it. New York State covers all the optional services. And as a matter of fact, sometimes that's why people move from other states to New York State. Because they'll not only qualify for Medicaid, they'll qualify for these extra services. Now, once again, politically, socially, is that right or wrong? We're going to have that debate when I leave the room. But I can tell you it does happen because my office sees it. All it takes in New York State to establish residency for Medicaid is you need to prove you live here. And you could probably do that in 2 or 3 days. You get a lease, you have your landlord sign it, you sign it, you go down to the DMV, you get a driver's license with your name on it, your new address on your new address from your lease on your driver's license. You now have 2 documents that prove where you live. You'll qualify. It's that quick. But as I said, New York State covers all the optional items and all the mandatory items. Not every state does. There's actually only one optional item that New York State doesn't cover that some states, especially states in the Midwest, does. There's something called a Christian Science hospital. And a Christian Science hospital is not a hospital in the terms that most of us in this room would use it. It's a place where you go and you just rest. There's actually not a doctor on duty there. And it's a place where Christian scientists believe that if you simply get enough bed rest, you'll get better. Now that will work for some diseases. But for some diseases, it's essentially ignoring them, and it doesn't work at all. Some states cover Christian Science hospitals, but New York State does not. The numbers. This is how I get involved in this now. From 2012 to, you can see, to part of 2015, Medicaid costs in Erie County alone, and this is just Erie County, not New York State, easily close to $1.5 billion. If you guys remember, that's 1,500 millions of dollars. But Erie County's portion is a much smaller percentage of that. New York State, faced with the idea that counties were absorbing a much larger percentage, finally said we're going to cap Medicaid costs that go to the counties. If they didn't, your property tax rates, or the top property tax rates of your parents or landlords or whoever, would see constant, steady increases every year. But thanks to the state, that doesn't happen. But by the way, then the state absorbs this cost, so your whatever fees or income you pay to the state, that's paying for it. There's been a steady, constant, roughly 3 to 4% growth of persons on Medicaid in Erie County since actually 2008. And this is the number that scares so many people, because it represents a very high percentage of the population who, as you saw earlier, don't make that much money. They're poor. But yet, each and every one of these people is a person. They still need services. Everything from, eyeglasses all the way down to prosthesis, up to pharmaceutical services, whatever normal medical services anybody would need. I love this. Until my office did this map, it didn't exist. We took all the Medicaid clients in Erie County, and we simply talked to the folks at Geographic Information Services at the county and said, we have everybody's zip code. Can you do a map? The first time they did this map, it had to do it overnight. Now they can do it in about an hour. And this tells you where the people on Medicaid are. It's not a surprise to understand that most of the people on Medicaid are in those red areas right there. That's the city of Buffalo. I don't think it should surprise anybody here, even if you're from outside the Western New York area, that inner city of Buffalo is composed of mostly poor people. Is anybody shocked with that? I hope not. Not if you've driven around Buffalo and Western New York. And as you can see, even the first ring suburbs, Lackawanna, Cheektowaga, in some cases Tonawanda, still have a significant Medicaid population. Even down here, this area is not very populated, but there's still a healthy number of people on Medicaid in places like Sardinia and Holland. I'll bet most of you haven't driven out here, but it's still a very rural area, but there's still a lot of people on Medicaid here. Yes? Oh.
15 minutes.
It's left?
Yeah.
Oh, then I'll go a lot faster, sorry. Okay, Erie County receives about 3,200 applications for Medicaid each month. Most of the applications are not new, but they're renewals or rejections reworked. We have 45 days to approve or deny coverage. Most of the time, we'll get it done a lot faster than that. Medicaid clients receive a loan for the cost of their health care. That's it, because if you come into resources, we'll pull that money back from you. So if your relatives die and leave you a lot of money, if you win the lottery, one of the things that happens is myself or my professional colleagues, we come and pull that money back. As taxpayers, I hope you'd be happy to hear that, because I'm sure all of you are. When I talk about Erie County's Medicaid population, most of the data comes from the New York State Medicaid Data Warehouse. The software used is written by a company called Salient, and the data itself is often referred to as Salient data or Salient. The data goes back as far as 2005. Some of the data that you're going to see in a few minutes is actually outside of Salient. I also have access to data from Erie County Social Services, and in some cases it benefits us to look at that in conjunction. Our first one, Medicaid costs by Medicaid category. The categories are established by the federal government. I wish I could tweak these, but I can't. It'll give you an idea where we spend the money. Most of it is spent in managed care and home health and nursing home. It shouldn't surprise you. It's spent managing your health or taking care of the very elderly or, well, inpatient, taking care of people in the hospital. Mental health is a healthy portion of Erie County's Medicaid budget, too. It's something I've talked about in the past. Because it seems to be a hidden population. People don't want to see it. People don't want to talk about mental health problems. But yet it's a very constant and very expensive series of issues to treat. This was also something that my office did that no one else had ever had before. It was a very interesting piece of information to talk about Medicaid by race. I know it can be a little incendiary, and the first time we did this, I confess, the county executive came down to my office, and very interesting proposition in and of itself, and said, oh my God. But what it really shows here is some interesting material. Many of the people on Medicaid, start looking at this, 30, 60, 70,000 people, almost as much as a third of this number, they're children, age 20 or less. Now, some of you, I hope some of you don't consider yourself children, but it's an issue how young this population is. When we did this, we started to talk about how this is going to affect us, not this year, but now chances are these people are going to be on Medicaid until they reach that stack up there, the next 30 years. This has huge public policy issues, huge public policy, well, I'll call it a huge public policy threat and a huge public policy concern. And you folks, as, let's say, masters in public health, this is stuff you're going to see for the rest of your career. These young people moving up into that stack. It's interesting, too, since I started to run this. When I first ran this report, these were the only categories. It was white, black, African American, Hispanic, Latino, and so on. And now, because of the proliferation of individuals who classify themselves as not just other, they classify themselves as, for example, Hispanic, African American, or Asian American Indian. Now the system actually will go out and list you how you classify yourself, which makes this report a lot more difficult now. And that's part of what happened here. It's become much more acceptable for people to list themselves as more than one race or mixed race. So I watched this number jump so much. But you can see right here, for example, Caucasian, white folks, if you add African Americans and Hispanics, it's still less than the number of Caucasians on Medicaid. I can't tell you the number of folks I've talked to who call into local radio shows or who, let's say, belong to certain political parties. They don't want to believe this. They don't want to believe this. I didn't make this up. The reality is most of the people in Erie County who are poor are Caucasians or whites. And here's another part, too, when we did this. We looked at the number of claims that people file in the cost per client. And once again, when those group of folks who would sit in a coffee shop and complain about how those people are bankrupting the county didn't realize that probably if there were 11 of them sitting around a table, one of them was those people. And it's been a problem I've had to fight throughout my entire career. Many of the elected officials who will stand there, especially from the suburbs, and say, this doesn't touch my people, it does. But it's hard to get them to see the truth of this. Once again, I'm glad that I had an opportunity to show you folks, because you see the kinds of populations that we're serving here. The other thing is, and we argue about this in my office, that this number is 15.6, but many of these other numbers are lower. Our project right now is to look at the map data that you have, that you saw earlier, and the map data of where people go to get Medicaid services. Because what we believe is happening, and it's just a theory right now, is that the reason those people at the top are getting 15.6 claims is because their doctors and services are closer. And so we're trying to find out if that theory is in fact true. It sounds like an easy thing to prove, but it's actually very difficult. We ran this by zip code, and I would imagine most of you don't have zip codes of Erie County memorized, so I'll just skip this real quick. It shouldn't shock you to hear that most of the top zip codes are in the city of Buffalo. This was once again a wonderful table to run for my colleagues at the Niagara Frontier Transportation Authority, the NFTA, the people who do buses in the subway, because they said, oh, look at that, we didn't know that. Because by definition, all of the people on this list are poor. So that's where they should focus their services. This is one of the reasons I really wanted to speak to this class, because some of you will have the ability to fix this. Not only does the Medicaid data warehouse have issues, demographic issues, like your sex, your race, your age, it also has what you're being treated as. And if you think about it, what you're being treated for, if you think about it, that makes sense. I can't audit a Medicaid payment if I don't know why it happened. So we see people's medical records on a regular basis. Many of the doctors who treat people on Medicaid, well, for one reason or another, they run people through the system. Some cases very quickly because they run Medicaid mills, or in some cases they don't have the kinds of technology that more affluent practices have. So when they code a patient's illness, a lot of them, we believe, go to the default, signs, symptoms, and ill-defined conditions. That, for one example, is that's a disease that a patient has, and then it seems to go away by itself. I believe that there's a lot of doctors who are sloppy and code things as signs, symptoms, and ill-defined conditions, when in fact it is something else. They just don't take the time to do it. Or they pass that coding off to a nurse or other assistant. But we look at that data, and I don't make public policy decisions based on this data, but folks in Albany do. And we've always wondered, how true is that? How clear is that? And what piece of the pie are we missing because we don't have it? So if the one piece of information I could ask you to do when you go out into private industry, when you go out into government, when you go out into not-for-profits, is explain to the people who are coding these that we look at this stuff and we need this, and it can help us make better decisions, and in the process, government making better decisions should make the work that people in not-for-profit or private industry better. But I understand it. Doctors want to see as many people as possible. There are people in the waiting room, just code it and go. By the way, you can see too, the number 2 disease after it went away on its own is mental health in Erie County. This was another table that we put together and people were surprised to see it. We looked at the prescriptions that were prescribed for Medicaid, and then we converted those prescriptions, because in some cases they had brand names, to their generic names. And what did we discover? The #1 prescribed drug in Erie County since 2012, hydrocodone, one of the most addictive painkillers you can have. And here it is in Erie County. It's the most prescribed drug, year after year after year after year. We knew that, but now comes the next question. Why? And how much of it is necessary? When I audit pharmacies now, one of the first things we do is look at their hydrocodone prescriptions to see who's writing prescriptions and to see if those prescriptions are all valid. We chase those as much as we can. A lot of those drugs are diverted to what they'll politely call secondary use, which is a fancy way of saying drug addiction and drug abuse. This was something we just finished, and the report that this is from is actually going to be released later this week. But for the first time ever, I got permission from New York State to link the Medicaid data warehouse data, the salient data, with data from social services for people who applied for social services and had income data. And so for the first time, we could see not just that you qualified, but we could see how much money you were making. How bad really is the poverty in Erie County? As I said, when I created my job, I wanted to be more than just someone who looked at data, just someone who looked at an audit data. I wanted to be able to provide some value. And this was a big part of what I wanted to do. And as you can see, some people are barely making it. Imagine living on a monthly income of $939 a month. There's no way those people aren't getting, and that was a piece of data I don't have, they're not getting assistance with their utility bills, they're not getting food stamps, they're not getting some other form of assistance. Because that's well below the poverty line. It's well below the poverty line. By the way, this data is also, as I said, it's clients 18 years of age and older. We did that on purpose because I didn't want to include children. Many of children don't work. So these are people who are certainly capable of working and either can't find a job or have a job, but they're not making any real money. Not the kind of money that might allow them, well, let's just say a trip to Starbucks is probably beyond most of these people. I also had the opportunity then to look at not just the number of clients, but their average income and where it came from. And that's another myth that we destroyed with this data. I can't tell you the number of folks who said, well, those people on Medicaid, they're not working. Guess what? Between salaries and wages, about 1/3 of them are. That destroys a huge myth that's out there that people are sitting home watching reruns of Gilligan's Island. No, they're not. They're just not making any real money. And many of these other folks, they can't work. If you're on SSI benefits, SS disability, or Social Security retirement, chances are something happened for you to be in those programs, and you're probably not capable of working. I'll be much faster, 2 minutes. All right, I'll skip through this then and just get to what I think you guys want to see. When I talk about the Medicaid data warehouse, we get data that looks something like this. I can run graphs, I can run charts, and I can run actual numbers. Now, if you're looking at this chart, and it's kind of funny to laugh at this, does anything stick out at anybody here? Anybody looking at one of these lines going, you know, that doesn't look right? Something happened here, didn't it? Now, that's the joke in my office. This is unusual that you will get something that jumps out at you this much. But I'll give you a hint. This was actually run for an individual business, so you can tell it's older business, but you can tell we ran this. What do you think the chances are that we audited these people? Better than average? Damn right. We want to know what happened here. The other thing we could do is, this is actually what data looks like if you don't chart it. This actually happens to be Medicaid claim services, and one of the things we did is we pulled up data by citizenship. And you can see most of the people are citizens. That was another thing that seemed to destroy certain of the myths out there. But we can look at not only your citizenship, but how much we paid, how many procedures you had. all of this information is available. And so one day, if you folks, as I said, if you're out working for a private firm, you may have access to some parts of this. New York State allows some groups to have access to this, they just limit it. You might only be able to see the salient data for your particular firm or your particular entity, or you might be able to see it for just a particular class of individuals. Like, for example, if you women's services, you may only be able to see that data for women. This was my favorite when we ran this for drugs: hydrocodone, acetaminophen, and ibuprofen, simply aspirin. Notice the first two items on this list are painkillers. I know a number of people have talked to me about ibuprofen. They said, well, wait a minute, why is that so high on the list? It's because if you're so poor that you're on Medicaid, you're probably so poor that you can't afford aspirin unless it's prescribed by a doctor. As I said, we look at Medicaid by the kinds of procedures that occur. We ran this, I think that's of 2012, and you can see we can look at what we're paying for. What did the doctor code it as? But this data is only as good as the person who coded it, and that's what's so important. And we'll skip over that. And we're here. I hope I haven't bored you, and I hope you're going away with some idea of the problems that Medicaid faces in Erie County.